Dr. Obagi, tell us about the Ultimate Skin Symposium and why did you choose that name?
We have a problem as dermatologists and plastic surgeon that really we are not addressing skin in an effective way in many of the medical meetings and many of the academies. We are, as a dermatologist and plastic surgeon, focusing more and more on procedures. And the procedures will not really show great if you don't understand skin and what skin needs and what procedure should be done to a skin that cannot tolerate this or substance or that substance or the laser or a peel. So we are trying to unify the approach to how to do a treatment or a rejuvenation by addressing skin as the main essential step. And that's why we choose the name, the Ultimate Skin Symposium, trying to tell physicians and attendee that the main focus here is skin. We're going to talk about the skin, so our patient will have the best results when we do procedures. And how to do the procedures depends on skin type.
What are some of the major global trends in skincare and clinical treatments that you're seeing?
You know, most doctors, when they treat, they really focus on a main problem presented to them by the patient. We have to go beyond that. We have to really try to understand that any problem we see on skin surface, it comes from dysfunctional cells deep below in the skin. So we really have to focus, rather than treating symptom and skin surface, on how to make a skin in totality better, functioning better, and at the same time resolving the main problem. We are trying to come with this idea in a big way for all the physicians. We want them to think that if you don't make a skin better, your problem or the main problem will only improve temporarily and in a limited way.
What are the main enemies of skin in your view?
Sun is still one of the big enemies of the skin. And the second one is not cleansing the skin properly to remove excessive amount of sebum that exists on skin surface. We know that 85% of the population have oily skin, and we know all men have oily skin. And what's lacking is that we are not trying to normalize the skin by reducing the excessive amount of sebum. And so we emphasizing now that this is enemy number 2 to the skin. Enemy number 3 to the skin is what you put on the skin that really your skin don't need. So if you really see you're full, you're not hungry, you don't eat. Your skin needs something to behave better, to act better. So if you don't apply the needed material, apply just things that you think is good for you, I think that's enemy number 3.
How do you guide consumers to stop making some of these common skincare mistakes?
Education. If we as physicians take it upon ourselves to educate patients, take 5 minutes, educate every single patient about the problem they have and what are the mistakes that led to have that problem, that will make that patient much better. And also getting involved in churches, in clubs, in school, educating people about prevention. And we really as physicians, we owe it to the public, not to wait for them to have a problem to come and see us. We owe it to tell them how to prevent such a problem that they don't have to come and see us or do invasive procedures.
What do you expect attendees to learn from this symposium? What are the key messages?
The good thing about the symposium is that it will give the physician immediately the knowledge and the tool and how to take care of their patient properly. From how to recommend a daily skincare, how to recommend a preventive approach, how to treat a medical condition quickly within the totality of restoring healthy skin, how to maintain the result indefinitely, I don't like to have patients have one facelift for 4 years later, another facelift, or procedures after a procedure from laser to peels. I really feel that once you do a major procedure that is needed, we have the knowledge and the know-how how to prevent the need for a second procedure or to delay the need for the second procedure. So the maintenance is very important. So this symposium will teach physicians when they go back how to expand their pool of knowledge to people who are involved as patients and people who can be involved as candidates for prevention. And the second, we will tell them how to do procedures after skin is ready, not do procedure when the skin is not ready for that procedure. So you're going to learn that. And we're going to tell them also, after you get involved with the patient, that patient should stay with you. Think of your clinic like the Skin Health Club. You really want those patients to be in that club. You be in the club to exercise all your life. Keep them with you all your life. Guide them, teach them, help them, and let them not waste their money on unnecessary things. And I think that will be very rewarding to our life as practitioners.
What are your new feelings about the use of hydroquinone, and what recommendations do you have?
We have learned actually a lot for the last 25 years. I was a very good proponent of hydroquinone. I recommended hydroquinone almost as an essential part of the treatment. And we are finding out that continuous usage of hydroquinone have led to a lot of, let's say, predictable results. We're finding that some people improve for 2-3 months, then the improvement stops. The answer to that was maybe this patient is building resistance. Hydroquinone is not working anymore. Then we are finding in other people that when they use hydroquinone indefinitely, thinking that they will keep spots away, are they getting much more weird pigmentation. Now the analysis we found out that when you take the melanin out of the skin, we are making skin photosensitive. And that photosensitivity makes skin more prone to inflammation. And that inflammation is creating weird pigmentation in spite of using hydroquinone. We're learning that, for example, that people who, when they don't use sunscreen when you are using hydroquinone, they are getting a problem that is very difficult to treat because the pigment now is deep, changing the whole texture of the skin. We call that chronosis. So we come in with a guideline now, use hydroquinone, so it's effective and safe, for a few months, stop, move to stabilize the melanocyte. We call that stabilization, where you don't need hydroquinone. Now, after taking that period of breaking down, you allow the skin to remelanize itself, and the photosensitivity goes away. If you still need hydroquinone, come back to it. Treat it for a short period, and then stop and go to stabilization or strengthening or reducing hyperactivity of the melanocyte. We call that the new pulse therapy of hydroquinone, which we represent today in the symposium. Also, we're finding out that many of the medical ingredients, such as retin A, which is a traditional trade name for retinoic acid, or other retinoids, if they use indefinitely, they are creating, after 2-3 months of repair, a continuous irritation. This continuous irritation creating inflammation and creating more damage. So we have found, and you build resistance. So we're finding out that medical grade ingredients should not be used continuously. Use them when you need them, stop, shift to what we call maintenance with something that allows skin to build back itself again without building the negative effect of those continuous usage of medical ingredients. And this topic is very, very important to tell the doctors and how to help their patient in the best way.
How do you think the use of internet sales sites for consumers to get products directly is affecting their skin health?
You know, if a woman is looking, or a person looking for a simple moisturizer or a simple sunscreen, they want to buy from the internet, I don't see any harm of that. But unfortunately, patients, let's say a doctor prescribed for them retinoic acid, fruit acid, or hydroquinone, or a benzoyl peroxide, and so they take that, they see that they improved with it. So now the internet is providing the same medical grade product here without consultation to physician. The patient tries to save the consultation fee or the visit to the physician depending on the internet. This self-treating entity is a disaster. And we see a lot of complication, sensitivity, we're seeing absolutely things that are not been expected from some continuous usage of a substance like hydroquinone, for example. So I am against selling medical grade on the internet if it has the purpose of a treatment without medical supervision.
We hear that you have a new book coming out in 2013. Tell us a little bit about it.
I'm excited that in my first edition of my book, which I published about 12 years ago, it was really a breakthrough in bringing the awareness of skin health. 25 years later, 30 years later, we have learned so much. I really like to share the knowledge I have learned with all my colleagues. It will be the only book that addresses the skin procedures, but put them in a logical sequence based on skin type, and it will take the confusion and the individualistic approach of treatment out from any practice and make the physician more in control of the patient from A to Z in a step-by-step approach, and give them the knowledge that will expand, enhance the result, increase patient safety, and tell them what procedure to use for each skin type, and know what to use for each patient, and absolutely will be a must to put them all in what we call the boutique of skin health.